Okay, now we're going to move on to the hip joint. The hip joint is also known as the coxal joint. That's the old Latin term for the hip itself. The hip joint is a very typical ball and socket joint. Its primary classification is as a synovial joint. Being a ball and socket joint, a typical ball and socket joint, it demonstrates multi-axial movement. In other words, we can flex and extend our hips, abduct and adduct, move the limb away from the midline and towards the midline, and we can medially and laterally rotate the hip. The hip joint is in its most stable position when it's held in extension, abduction and medial rotation. At this point here, the articular surfaces are at their maximum, the maximally congruent point, and the ligaments and capsule are taut. The articular surfaces of the hip joint include the head of the femur on one side. This forms about 2/3 of a sphere. It's spherical. It's very regular in shape, and the whole thing is covered with hyaline cartilage. The only exception being the fovea capitis, which is a small notch in the center of the head of the femur here. It's devoid of hyaline cartilage as a ligament inserts into this point here. The hyaline cartilage is typically thickest on the top part of the head of the femur here. This is where the main weight-bearing section of the ball component is. The socket part of the hip joint is known as the acetabulum. And when we look into the acetabulum itself, look at the innominate bone, the hemipelvis, from a lateral aspect, we can see the acetabulum very clearly. The acetabulum is formed partly by the ilium, partly by the ischium and partly by the pubis. These three components fuse very early on in life to form this fairly deep socket. But when we look into the hip joint itself, into the acetabulum itself, we see two sections to it. We see this blue horseshoe shaped area here, which is the articular portion, and then there's this area in the center that is devoid of hyaline cartilage. This is the non-articular portion. The non-articular portion is called the acetabular fossa, and typically contains a fat pad within it, a fibroelastic fat pad that is covered in a layer of synovial membrane to keep the fat pad extra articular. The acetabular fossa itself is orientated laterally, anteriorly and slightly inferiorly, and once again the thickest portion of the hyaline cartilage is typically found here in the central section of the acetabulum. Again, this is the main weight bearing area of the acetabulum when we're in an upright stance. Although the head of the femur and the acetabulum are very congruent, they fit well, there is a good size ratio between the two articular surfaces. The acetabulum itself is further deepened by a structure known as the acetabular labrum. This is a lip of fibrocartilage that passes all the way around the outside in this green area that we see here, all the way around the outside of the articular portion of the acetabulum. Here is the labrum again, and here is a diagram taken from primal pictures, again showing the acetabular labrum itself. It extends laterally to further envelop the head of the femur, and the diameter of the periphery of the acetabulum is smaller than the diameter of the head of the femur. In this way, it creates a suction cup for the head of the femur itself. It holds the head of the femur into the acetabulum fairly firmly. This is one of the major stabilizing features of the hip joint itself. The acetabular labrum is triangular in cross section, and it completes. It comes all the way around the acetabulum itself, but is deficient inferiorly. This section here is replaced by a structure known as the transverse acetabular ligament. The hip joint is encased in a capsule. Again, the capsule is a typical capsule. It's a double layer of fibrous tissue, with the external layer being very complex and very strong. It's one of the best developed capsules that we have in the body, and it's strongest anteriorly and superiorly, its primary function being to limit extension. Now, whilst most capsules are fairly simple structures where the collagenous tissue or the collagenous fibers pass from beyond the articular margins on one side to beyond the articular margins on the other side, the capsule of the hip joint has got three sets of very definitely orientated fibers. It has longitudinal fibers that pass from just beyond the acetabulum, about 6 millimeters beyond the acetabulum. They extend all the way down here to the intertrochanteric line anteriorly, the intertrochanteric crest posteriorly, and the base of the greater and lesser trochanters. These fibers pass parallel from one beyond one articular margin to the other. They are further reinforced by a series of oblique fibers. These oblique fibers that we can see spiraling round here come round from the top of the acetabulum round to the bottom of the acetabulum, passing anteriorly. The third set of fibers are these ones down here. This is known as the zona orbicularis, and typically the zona orbicularis has no bony attachment. Instead, what it does is these are circular fibers that come all the way around the acetabulum to actually constrain the acetabulum, stop it bulging out during extreme movements of the hip joint itself. This organisation of the capsule makes it a very strong capsule indeed. Its primary function being that to limit extension of the hip joint. Inside the capsule, we have the synovial membrane. On this cross-section of the hip joint here, we can see the capsule and the ligaments on the outside here, capsule and ligaments on the outside here. And the synovial membrane is a typical synovial membrane. It attaches to the margins of the hyaline cartilage. So here we can see the on the head of the femur here we can see the articular surface, the hyaline cartilage here. The synovial membrane will attach to the margins of the hyaline cartilage, come down there, it will cover any intracapsular bone that we have. It then lines the capsule before attaching to the articular margins on the acetabulum themselves. Synovial membrane typically always attaches to the edges of hyaline cartilage. So again, what we would see here on the acetabulum, we would see synovial membrane attaching to this articular margin here, comes down over the fibroelastic fat pad, comes down here, lines the capsule, covers any intra-articular bone before attaching to the articular margin on the head of the femur. It's a typical sleeve. It passes all the way around the head and neck of the femur, and the role of the synovial membrane is to produce synovial fluid. There is a point to note that on the anterior aspect of the hip joints, there is an opening in the capsule, and through which herniates a part of the synovial membrane itself. Here on this diagram, we can see this green spot here with a slightly lighter area in the center. This herniation of synovial membrane is known as the iliopsoas or the iliopectineal bursa, and its function is to separate the tendon of iliopsoas from the underlying hip joint margins and superior pubic ramus. As iliopsoas passes down over this structure before attaching onto the lesser trochanter, as the muscle contracts, moves up and down, the function of the iliopsoas bursa is to prevent excessive friction. Now, the iliopsoas bursa itself is a communicating bursa and can be prone to irritation with overuse